Welcome to Nurture KC News, a periodic podcast brought to you by Nurture KC. My name is Tracy Russell, and I'm the executive director here. And today we're going to look at the Fetal Infant Mortality Review Program at Nurture KC. With me today is Katherine Campbell, who is our Fetal Infant Mortality Review Coordinator. And we call this FIMR for short, so that's how we'll refer to it during the podcast today. FIMR is a difficult program when you're looking at fetal and infant death, but such a vital one when it comes to identifying trends in these deaths in Kansas City, the causes behind them, and how we might address them going forward. I think Katherine does that masterfully. She is a very empathetic person as well as extremely skilled in what she does. And she really balances that care for those who have experienced a loss with the importance of determining why and how we might move forward. So with that, Katherine, why don't you introduce yourself? Tell us how you ended up here and what your background is.
So I'm Katherine Campbell. I am a nurse by trade. I've been a nurse for almost 13 years. I've done pretty much everything under the sun whenever it comes to nursing. So started out in long-term care, went to med-surg, med-tele, ER, and then kind of found myself in the world of maternal and infant health, working postpartum. And I kind of got to the point in my nursing experience that I wanted to do something outside of the hospital and found this position and thought that it would be really interesting to kind of see what's going on outside of the hospital in the community whenever it comes to maternal and infant health. And so that's kind of how I started here. And it just kind of grown into what the program really is now.
Well, and I think speaking to the stability of FIMR, you're just the second coordinator of this program.
Yeah. So my predecessor was here for over a decade, and then she retired, actually. So whenever I came in, it was a fairly established program, but had to do a lot of work to get it up and going again.
That's great. So why don't we just dig into kind of the nuts and bolts of FIMR? Can you tell us a little bit around kind of the purpose and the philosophy of FIMR and just kind of give us that context?
So the basic purpose of FIMR is to decrease the infant mortality rate. So it's really about looking at cases, making recommendations off those cases to make initiatives and programs to decrease that infant mortality, and in turn, improve the overall health of mothers, families, and infants. So it's really about looking at the whole package and seeing what we can do to help, like I said, not just the moms, but also the babies.
Okay. And is there a national scope to FIMR, or is it more of a local effort?
Yeah, so the Kansas City, Missouri FIMR does follow the National FIMR program, which is a two-tier system. So the first tier is the case review team, and then the second tier is the community action team. So the case review team looks at cases that are de-identified by myself, abstracted by myself, and we look at, okay, this is what happened in the case, and we make recommendations specifically off of that to have prevention in the future. So if we have an unsafe sleep related death that occurred, then we look at what kind of education was provided, what kind of safe sleep surface did the family have? Did they have access to a safe sleep surface? And we make recommendations off of that. So one recommendation that we worked off of for a very long time was that families and caregivers in Kansas City, Missouri will demonstrate safe sleep for nap time, bedtime, every time. And so we took that recommendation to the community action team and we said, this is something that we think that you should work on. The community action team then takes those recommendations and makes initiatives with it. And so the community action team is really looking at that broad recommendation and then making it more of a very specific action.
Okay. And so let's delve into kind of what your process is for bringing cases before that review team. Who serves on that review team? What kind of expertise do they lend to the process?
Yeah. So, kind of how the process starts is unfortunately a death happens, whether that be a fetal demise or stillbirth or an infant death. And that infant death can happen up to 365 days of age. So the state reports the deaths to me. And so then I'm able to request records from various entities that is specifically related to that pregnancy and to that infant. And with that, I abstract out the information and I present a case to the to the case review team. The case review team has physicians, nurses, social workers, community leaders, and stakeholders who are really invested in improving the health of families, moms, and babies. And then, like I said, we look at that case and we make recommendations specific to that case.
Okay. And so it really is a very public-facing committee. So you would expect these folks to be just very well informed about what's going on.
Yeah, so it's people who not only have a little bit of a clinical understanding, but also an understanding of what's happening on the ground, grassroots, what's happening within the community.
And so is this a rotating committee or does it stay pretty stable since you've been here?
We kind of have a rotating committee in the sense of, physicians sometimes have to leave the committee because they have other responsibilities, or community leaders, again, have all other responsibilities. But we really try to maintain a certain percentage of clinical versus non-clinical, and we try to maintain membership from organizations that we know are also doing the hard work that we do here at Nurture KC.
Okay. And so talk to me a little bit about the catchment area that you serve. How do you determine which cases that are going to come before the review team?
We also look at the zip codes with the highest infant mortality rate. That's the zip codes that we focus in on and that what the state gives us. And not saying that deaths that occur outside of those are not unimportant, but really looking at a very specific zip code kind of helps us watch trends throughout the years.
Okay, so you can pinpoint what's going on in these high mortality rate zip codes.
Yep.
And that's just Kansas City, Missouri.
Yes. So it depends on what your FIMR program kind of encaptures. So there are some statewide FIMRs. There are some local FIMRs like ours, but they might do countywide or they might do citywide. We just do the top zip codes with the highest infant mortality rates.
And I view this as so important, particularly right now, since this is the only operational FIMR in Missouri right now producing that local information.
Absolutely.
So what do you see in terms of disparities in fetal and infant death in Kansas City?
So just generally speaking, our Black infant mortality rate is higher than the white infant mortality rate. And that's 2 to 3 times higher, depending on the year and depending on where you're looking. And that's not just in Kansas City, but that's statewide. That's nationally as well. And so that's the biggest disparity that we're seeing is the Black infant mortality rate versus the white infant mortality rate.
Katherine, let's delve into FIMR's priorities a little bit. How do you develop those and how do you determine what actions you're going to take?
Yeah, so the top priorities for FIMR right now is access to care, safe sleep, education surrounding decreased fetal movement, and with the access to care, I guess I should take a step back. That's not just having healthcare, but it's also how can you access that healthcare. So transportation, housing, food insecurity, it's all of those things wrapped into being able to just get to healthcare. So those are the big ones. And what we do with those recommendations is we keep them broad so that whenever we take them to the community action team, they have a wide variety of what they could be working on. And so we take it to the community action team and we say, hey, these are our recommendations for the last couple of years, and kind of go from there as far as initiatives and programs that they want to start.
That's really important that you're looking at all of those factors, not just the medical factors that occurred, because we know this happens on a continuum.
Yes.
There are factors leading to these consequences ultimately.
Absolutely.
Let's move into a specific project that I know you've been working on for a couple of years, and that is the Safe Sleep Initiative, which we've coined the Nurturing Safe Sleep project here at Nurture KC. Can you talk about what your work has been on that, who your partners have been, and what the results have been with Nurturing Safe Sleep?
So we took that recommendation to the community action team, and they decided that they wanted to work on helping the metro hospitals obtain the Cribs for Kids Safe Sleep certification. At the time, whenever we started this initiative, only 2 hospitals in the area had it, and that's Children's Mercy, because of course they're the gold standard, and University Health Hospital Hild. And so we went to the hospital and we said, hey, we want to help educate the community on safe sleep, and this is a great way to ensure that everybody is getting the message and that it's concise and that it's consistent. And we had hospitals say, yeah, let's do this. And so we worked not in just Missouri, but also in Kansas, because we know that those families are moving across the state line. And we know that they don't see that state line like, the government does or whoever does. And so we started out with Providence, and they got their certification. Then we moved on to Liberty. They got their certification. And then we've worked with University Health Hospital Hill and Lakewood, North Kansas City Hospital, and Advent Health in Overland Park. So started out with just 2 in the area, and now we're up to 7. And 6 of those we helped obtain that Cribs for Kids Safe Sleep certification.
What I found so surprising when you started the Safe Sleep Project was how prevalent unsafe sleep deaths are across the city. Can you speak to that a little bit in terms of the common occurrence of unsafe sleep deaths and go into a little bit of detail about how that breaks down by race?
Yeah, so it's said that it's the number 1 preventable infant death, not just in Kansas City, but statewide. And so if we are able to educate families, not just the parents, it's also the caregivers, it's also the people who are going to be around that baby and those families, educate them on what safe sleep looks like and how to do safe sleep, how to practice safe sleep, but then also making sure that there's resources out there to have a safe sleep surface. You can talk about safe sleep all day long, but if families don't have a place to put that baby down, then it's for nothing. And so it was not just education for the families and for the staff members, but it was also making sure that they knew where to go to get a safe sleep surface.
I think it's so important to point out that there are issues of access here. And so looking at this in the full context of what might lead to unsafe sleep, such as not having access to a safe sleep surface. These are easy fixes, and I think drawing the community's attention to that is so important. So as you were considering this initiative, there are all kinds of strategies that you might have adopted, such as a public awareness campaign. Why did you start with targeting the hospitals to adopt Nurturing Safe Sleep?
Because that's usually where families first get education about how to care for their baby. And so if you're starting out from the very beginning, seeing safe sleep, watching the hospital personnel practice safe sleep and having them talk to you and educate you on what it looks like, how to do it, then you can start it from the very beginning. And so a lot of times too, families look to those nurses, those doctors, the techs, the whoever are in that room. They're looking to them for guidance and for education. And so making sure that the hospital personnel knows how to do it also is very important. And so that way there's no miscommunication and there's not miseducation out there.
So hospitals are the touch point,
yes,
for beginning this education.
Absolutely.
Certainly doesn't end with them.
No.
But that's kind of the first stop.
Yes.
Through this. So, Katherine, obviously there are some established standards to get that safe sleep certification. Can you walk us through what those requirements are?
Yeah, so the basic requirements to obtain the Cribs for Kids Safe Sleep certification is the hospital has to have a policy regarding safe sleep. Staff has to be educated. There has to be a program in place to educate the families and the parents. There has to be education on the website, and then all imaging that is produced by the hospital or the facility has to be showing practicing safe sleep. So those are the very basic requirements from Cribs for Kids. And that's just to ensure that every hospital is set to that same standard.
Well, I think that's wonderful that these hospitals have been so willing to do this, and hopefully we'll see others follow suit outside of our project since it has concluded now.
Yes.
Right. Well, why don't we move on? Because I know in your spare time here, you have several other initiatives that you've begun as a part of what you see in the review. And so can you speak to some of those that have that community-wide impact as well?
Yeah. So one thing that we created from the recommendation about access to care is a prenatal care algorithm, and this algorithm kind of is used case by case to ensure that in that case, with that mother, with that pregnancy, received the best care that she could and that was available. And so it breaks down when did she first initiate prenatal care, how many visits she had, and what the percentage of visits that she was able to attend. And that kind of helps us in a very consistent way of saying, yes, she was able to access prenatal care in a sufficient way or in an insufficient way. And so again, it's just really a way of us to be able to measure in a very consistent way. So that was one thing that we created and that we have shared with other FIMR programs. And then we also have the Kansas City Perinatal Bereavement Alliance. And so this alliance has hospital personnel who are working with those bereaved families. So nurses, social workers, we're trying to get a doula on board, and to really make sure that every family is getting that same level of care and that they have access to the same level of mementos and pictures and anything that family needs to help them through the grieving process. And so it's just a way for us to get together and kind of troubleshoot what's going on. If a hospital might need help with a policy to, let's say, do photos, then other hospitals that already have that in place can kind of help with that process. So it's just a way for us to kind of network and work together to make sure that families are getting the best care possible in the area.
To me, that really epitomizes the philosophy behind FIMR in terms of walking alongside these families, recognizing what they need, and trying to deliver it community-wide.
Yes.
I think that's so important. Okay, so as we come near the end today, FIMR's been around for 20 years.
20 years, yes.
Can you tell us a little bit, just kind of peeking into the future, what you see for the program, the value that it brings, where you think it should be going?
Yeah, so I'm working on the 20th anniversary report. So it'll be kind of some data throughout the years, looking at where we started and where we are now. We have done a total of 407 cases in that 20 years. And so it's really going to be just kind of what happened, like I said, from the very beginning. So that's going to be the next big thing that comes out of FIMR, I think. And then as far as future projects and stuff, we would really like to see a project around education about decreased fetal movement, what education our families getting, and how can we make that better for them. But then also education on vaccines, vitamin K, erythromycin, and that's vaccines for both mom and baby. And also I'd like to see a lot of diversity training for the hospitals, for clinics, for whoever, because we're not just one culture here. We have multiple cultures, and every culture sees pregnancy and, unfortunately, infant deaths and fetal demises or stillbirths differently. And so how can we help those families through this through that kind of time? So those are some things that I'd really like to see in the future, and projects and initiatives that I feel like we could really work with.
Well, and I think a hallmark of FIMR has been to not stand still in time, that we keep moving to best serve those families going forward and to honor those who've experienced a loss by continuing to evolve in what we look at as important and offer that education for real change in the city. Well, thank you so much, Katherine. Like I've said, it's unbelievable the job you do, and the caring approach that you apply to our FIMR program. So I can't thank you enough. If you would like to learn more about our FIMR program, please go to our website. It's www.nurturekc.org for more information. And just some upcoming events that we have here at Nurture KC. Our annual meeting will be June 20th, and the registration for that will be up sometime in May. And this year we're going to look at maternal mental health issues, certainly a key driver in both mother and baby well-being. In addition, you can follow us on social media through Facebook, and you can also access our annual report on our website that tells you all about some of these projects that Katherine has talked about and gives you an idea of the direction we're headed. Thank you so much for listening.